welcome to our Health Informatics 101 news channel. This week we're going to be talking about the course's week 1 topics, which mainly include defining the term health informatics and what implications come with the field. So we'll be covering both of the readings and giving you some of our own insights on what we thought about the cover topics. So first we're going to dive into the first reading and how healthcare informatics is defined. The definition is stated to be an integration of healthcare, computer, information, and cognitive sciences to help manage healthcare information. I personally think healthcare informatics is super important because it combines healthcare and technology to allow people such as doctors and nurses to give their patients the best care by having technology that gives them well-rounded information on their patients. There's also nursing informatics, which is a subset of healthcare informatics, but it's more geared towards the nursing field. So the article also goes over various implications that come with the field, with one of them being policy implications. So policy implications is when policymakers utilize data from clinical and managerial implications, which we explain later, to inform their decision making about public health issues. So an example of health policy and health informatics working together is meaningful use, which encourages the use of electronic health records in all health systems nationwide. With this initiative, however, there are issues of oversight and misrepresentation. Now I'm going to hand it off to Lily, who will be talking about the other implications that come with healthcare informatics.
Along with policy implications, health informatics can also play a vital role in clinical and managerial settings. For both inpatient or outpatient visitors, informatics is utilized to bridge the gap between the clinical process and technology. Some examples of this include electronic medical records, online portal systems, and vital sign machines. By collecting, storing, and analyzing this data, it will allow for informed practice and evidence-based care by healthcare professionals. As for managerial implications, informatics suggests improvements in communication, time management, and delivery of information for staff members and patients. Managerial applications aid in payroll functions, material control, and finance and administrative factors. By interpreting and modifying this data, it can be utilized for important decision-making processes. In my opinion, the implication of informatics in both clinical and managerial settings has shown to be beneficial to the overall hospital process. By utilizing a user-friendly informatics program, it will allow for a more cohesive and effective healthcare system that will benefit both patients and healthcare staff. Now, let's hear from Ambika and Jason.
The real-life application of health informatics is best evidenced in monitoring rheumatoid arthritic patients. The University of Manchester's Connected Health team recently developed a smartphone app that would allow patients to input their symptoms and how these symptoms impacted their daily life. This data is then embedded into the EHR and the results are presented in a graph format. At the same time, pharmaceutical giant Pfizer is creating a medication adherence app which will monitor if rheumatoid arthritic patients are taking their medications on time. Researchers discovered that when patients input their data on an app, they can see short and long-term trends. This matters because clinicians can then make more informed decisions about the best course of treatment for patients. I agree with the claims made in the research because data that is graphed can help patients better understand their own health. In regard to medication monitoring, I think that it will be helpful for patients to successfully complete their drug treatment. Overall, with the rise of digital health apps, I think that there will be more platforms to track patient data, which will further support evidence-based provider and patient communication.
Based on Professor Dixon and patient Curran, who took part in the study, said, consumer technology provides a huge opportunity to improve the management of patients. Moreover, daily remote monitoring through a smartphone can work and offer benefits to both patients and clinicians. Health informatics and nursing informatics are closely related in evolving health systems. More advanced technologies are being developed and must go with implications in the managerial, clinical, and policy setting for all participants, such as nurse, provider, manager, and politician. In addition, if remote monitoring such as smartphone app is appropriately used, it will be easier to create an effective treatment plan and capture disease activity for both patient and clinicians.